And as the weather begins to cool down, a lot of New Yorkers may think the threat of West Nile virus is done and over with.
That's not true. New York City has seen 17 infections and 2 deaths from the West Nile virus. And across our area, between New York, New Jersey, and Connecticut, there have been 55 cases. One of those cases, Lisa Oz, wife of Dr. Oz. Now, she was here on our couch last week, did not make mention of it at all. But hold that thought. We also have with us Jeff Stier from the National Center for Public Policy Research. He's here to talk about the city's efforts to stop West Nile from spreading. Nice to have you both here. Lisa, what happened?
Well, I was sick. I felt like I was deathly ill. I couldn't open my eyes. I felt like I'd been given a bottle of Ambien. And my husband, of course, is like, let's go out and go for a walk. You just need to shake it off. And about 3 days later, when I had recovered, he did some research and he said, I know what you had. It was West Nile disease. So thanks, honey. I thought you just said I needed to shake it off.
So, I mean, did you go and get treated for it?
I did not. I'm one of those undocumented cases of West Nile because I did not go to the hospital and I did not have a blood serology. I was just diagnosed by my physician. I happened to live with him. But most cases, about 80% or 4/5 of cases do go unreported. And most of the time, it's not serious. But if you start to have neurological symptoms, then you definitely should go to the hospital and get support.
And you don't have that going on?
I just had a headache and a low-grade fever and exhaustion.
Jeff, we said in the introduction that you were going to talk about the city's efforts to battle West Nile virus, but actually, more accurately, you're talking about the lack of effort, and you think we've made a mistake. Too little, too late?
That's right. It's too little, too late, and we need to do more. The city is the mayor and his health department are so focused on telling us how to eat that they're not doing the fundamental work of a city health department, which is protecting us from a disease like West Nile virus, which means spraying a very safe pesticide early enough, widely enough, and then telling everyone, hey, the pesticide is very safe. It's the West Nile that could be very dangerous.
So why aren't we doing it according to you or your theory?
I think the mayor recognizes that people in New York City are afraid generally of things called pesticides, and we don't want them sprayed on us, near our dogs, and near our babies. The city should be out there telling us, hey, the chemical in the pesticide that kills the mosquitoes is actually the same chemical that's approved to kill lice on babies and fleas and ticks that you put on your dog. Here they spray at 1 a.m. to 7 a.m. and it's done. It's safe to go out. And the warnings the city has put out had poison control numbers on them. Instead of saying, hey, this is a safe pesticide, West Nile is dangerous, they're saying close your windows, shut your air conditioner, turn off your air conditioner, stay inside. And people were afraid to go out hours later. There was panic on the Upper West Side where I live.
So, Jeff, I read your op-ed piece in the New York Post. Are you saying that the city is like caving into activists who are putting the fear in us about pesticides?
That's exactly what's happening. Unfortunately, the mayor should be leading and using his bully pulpit to say, hey, we've got a dangerous disease. If you're healthy, hopefully it won't be too bad, but we all have heard of the cases where someone who has a compromised immune system, an elderly person, can die from this. We don't need to be getting West Nile virus when we have a very safe pesticide that's been approved since 1975. But the mayor and the health department should go out there and focus on some leadership and say, hey, this product is safe, we're spraying it to protect you, and we're going to be okay. Instead, they're saying, we know people are worried about it, so we're only going to spray as a last resort.
Lisa, where do you think you got it, by the way?
I think I got it in Hamptons.
Come on!
I know, and you're there. But I do think there needs to be a balance. And in the 60s, we said DDT was safe. So Envo, which is the pesticide we use, is generally safe, and which is why we use it. But there are a lot of peer-reviewed scientific journals like Journal of Toxicology, Contemporary Pediatrics, that have shown that there can be risks associated. So I think there's a prudent use of shouldn't just willy-nilly spray.
I agree 100%. There was a warning in Massachusetts that I liked a lot better than the warnings in New York, which terrified everyone. It said, don't let your kids run behind the truck spraying pesticide. That's reasonable. I think that's what we needed here in New York, and then saying it's safe when used as applied. I agree with you.
The other thing, which is probably conversation for another date, is there's a spike in West Nile. I mean, the number of cases a year ago versus this year is significantly lower. I think it's 700 versus about 1,900 cases.
This is one of the worst years, and we're only going to be hearing more about it now. And you're right, Lisa, there are a lot of unreported cases. But tragically, there are people dying because of West Nile virus. It could have been largely prevented if the mayor and the city health department had sprayed earlier and more widely. What they did was they sprayed in Staten Island when they found some mosquitoes in Staten Island that were infected with it. And then when it eventually came to New York, weeks later, to New York City, to Manhattan, I'm sorry to insult the Staten Islanders, but Manhattan, when it came to Manhattan, everyone freaked out. Oh my God, it made it to Manhattan. Like, there's no ferry. Like, it's easy for a mosquito to get across into Manhattan.
Right, and it's free. They don't have to pay on the toll on the Verrazano.
Exactly, and the mayor made it sound like, oh my gosh, we didn't know it came here. They should have been spraying as soon as they knew about it. And instead, because we were being so precautionary about the pesticide, they waited until, unfortunately, it was too late and many people have now gotten sick.
All right, Lisa, you're okay?
Yeah, I'm fine. I was just going to say, the most important thing is not to rely on the government, but to keep your immune system strong, so if you do happen to get it, you'll be able to weather it.
And what are you taking? Are you taking anything
Well,
right now?
vitamin D in the summer, you don't need so much, but vitamin D and get enough sleep. Those are two of
That's
the best
it?
things for your immune system.
And a little love and tender care from Dr.
Yeah,
Oz.
that doesn't hurt.
Thank you, Lisa Oz. Jeff Stier, nice to meet you.
Likewise.
You work for a think tank, right?
Public policy think tank, the National Center for Public Policy Research.
Beautiful. Appreciate it.